So today I will talk about history taking, and after I cover everything, or after you watch this video, or before you even watch this video, you have to go and check the university checklist because it might vary from each program. So you don't want to lose any marks, so please go back and check your university checklist before or after viewing this video. Now, let's say you have a patient that is 50 years old, male, and he has back pain, and you have to take history. The first thing you have to do is introduce yourself. And you can simply do that by saying, hello, my name is Abdurrahman Tamimi. I'm a 50-year medical student. I was assigned by my senior doctor to have a talk with you today or to take your history. Is it okay with you? By saying that you are taking consent, introducing yourself, tell him, I want to assure everything will be confidential between you, me, and my senior doctor. And are you comfortable here? Then you take the confidentiality and assure the privacy. After that, tell him briefly, can you tell me your name, age, and where are you from? So basically, you just introduce yourself and you gather some general information about the patient. He said, I'm 50 years old, my name is this, I'm from this country. And then tell him, so what has brought you here today? He will say, I have back pain. So then after that, you'll start working on this. We call it the WAAB. It's 2 W's, 2 Q's, 3 A's, and 1 B. And if you enter the exam and they give you a paper, you can just have 2 seconds to write those down. It will help you a lot. And after a lot of practicing, those letters or those words will be stuck in your mind and you won't have to write them down on a paper. So the first thing you will ask is when, and then where, and then the quality, and then the quantity, aggravating, alleviating, associated symptoms, and belief. So those things will almost review everything or cover all the questions that you have to ask about the presenting complaint. If it was pain, if it was, for example, let's say syncope or shortness of breath, you might have to use another method. But this method is very useful if the presenting complaint was pain. So he has back pain. The first thing you'll ask him is, when was it? And you can add sub questions under the first W. So if the first one will be, when was it? Then we'll ask him, what were you doing when it started? Was it all of a sudden or was it gradual? Is it becoming worse? Is it continuous, or it comes and goes away? So we have covered the first W. The second W is you'll ask, where is it? And after you ask where is it, he'll point at his back or he'll try to tell you where it is. You will ask him, does it radiate anywhere else? After he tells you or answers those 2 questions, you cross the second W and you go to the first Q. You'll tell him, can you describe for me the pain, which is the quality of the pain? And it's better that you give him examples. Is it aching pain? Is it stabbing pain, for example? And he will tell you specifically what kind of feeling that he has. The second W is the quantity. Tell him 1 out of 10, how bad is your pain? And 10 is the worst pain that you have ever felt. And then he will tell you, and then you cross the second W. You go to the 3 A's. The first A is, or you can cover 2 A's together. You ask him, can you tell me about the alleviating and aggravating factor? The alleviating is, for example, when you lie down, does your pain becomes better? Aggravating is like when you walk up the stairs or you walk on a hill or you walk down from a hill. You have to relate the alleviating and aggravating factor to the disease you are thinking about. For example, if I'm thinking about GERD, I will try to associate it with position. For example, when you're lying back, do you have heartburn? If I'm trying to think about peptic ulcer, I'll try to relate it with food. So you have to also give examples about the alleviating and aggravating factor with the disease you're thinking about. The last A is the associated symptoms, which is one of the most important things that will help you to come up with a diagnosis. I have back pain. I have to ask questions that will help me to come up with my diagnosis. I have to ask about fever. I have to ask about stiffness. I have to ask about involvement of other joints, eye involvement. For example, if I'm thinking about ankylosing spondylitis, and so on. So you have to ask about the associated symptoms, which are the other symptoms that will help you to come up with the diagnosis. The last one, you can also ask, have you done anything or took any medication to help you relieve the pain? This might come also with the alleviating factors. The last one is the beliefs. What do you believe this might be? Some university checklists might have I's instead of the B, which is, do you have any ideas, which is the first I, what this might be. C is for concerns, do you have any concerns about your condition? And E is for expectation, what do you expect from us? Now, all of this will help you to go around or cover the presenting complaint and help you come with a provisional diagnosis. After you cover those, you go for the review of system. Review of system, you ask just general questions. I'd like to start from the head and go down to the toes. I ask him, do you have any headache? Do you have any problem with vision? Do you have any problem swallowing? Do you have any chest pain, changes in breathing pattern, any changes in your bowel habits such as constipation and diarrhea? And further on, I go down. So it depends. Everyone has a style in reviewing the system of the patient. After that, you have to ask about the past medical history. You ask about any chronic diseases. You have to give examples such as diabetes, hypertension, and you have to ask about previous admissions to the hospital, previous surgeries. Is he on any medications? And if he is on any medications, you have to ask the patient if what is the dosage, and is he compliant to the medication, and what type of medication he's taking. He might tell you, I'm just taking diabetes medication. You have to tell him what kind of medications are you taking. It might be metformin, it might be insulin, and you have to ask about the dose. And after asking about the medications, ask about the allergies. So you ask about chronic diseases, previous admissions, previous surgeries, medications, and allergies. After that, you go to the family history. You ask about anyone in the family had a similar condition, or anyone in the family has a chronic disease such as diabetes or hypertension or so on. Then you go to the social history. In the social history, you ask about specific things. It might vary between patient and the patient. For example, if the patient was a child, you might ask different questions. So you ask about his work, what kind of work that you do. For example, this patient is 50 years old, he has back pain, so he might work in construction, he might carry heavy luggage. So you have to ask about his job. You ask about, does he exercise, does he smoke, does he consume alcohol, how is his diet, does it consist of fatty food, is it home food? So you have to ask about this. After that, you've covered everything almost. You have to summarize the case and then ask the patient, does he have anything else that he wants to add? And again, before I end this video, you have to know that the history taking might vary from case to case. If the patient was a lady, you have to ask about her menstrual history and her obstetric history. If the patient was a child or a pediatric case, you have to ask other questions as well. But this will give you a general idea about how to ask questions and how would be the flow of your questions if the presenting complaint was pain. Thank you very much, and I hope this video has helped you.